Welcome my friends to my channel. I'm Bob Schrupp, providing you with physical therapy treatments you can do within the confines of your own home. And that's pretty cool, I think. Today I'm going to talk about bicep tendonitis. That's a pain that you get up in the shoulder and you generally feel when you're using the arm, bending it and flexing the arm. You can feel a little bit this way even because it does provide some flexion too. But generally the pain is up in there. This may be a nagging pain that's been going on for a long time. It just doesn't go away. And like I said, it's up in the shoulder even though it's coming from the bicep. The long head of the bicep, what they call, because that's the tendon that goes up in there. This is a simple treatment you can do for it. I think this is something you can try in the confines of your own home. What you're going to do is get a pillow and you're going to keep the arm flexed so the bicep is nice and relaxed. Palm is going to be up. You're going to expose the skin here. You do want to be able to get skin on skin basically, because you're going to use your fingers. 2 fingers, finger on top of finger, maybe 3 fingers, whichever works the best. And this is the difficult part. You got to find the groove where the bicep tendon runs through, and that's on this upper bone here, your humerus. And what you're going to do is you're going to rub across that tendon. You should find it should be tender. I mean, obviously, it's part of the problem. That's why it's giving you the issues that it is. And so what you're going to do is you're going to get in there and you're going to rub very, very hard. I mean, I'm just not just moving the skin. I'm getting down deep into the tendon and I'm trying to roll the tendon, roll my fingers over the tendon. Now, generally, what you're going to find, if this is the correct thing to do right now, is that as you start to rub the tendon, after a minute or two, it becomes numb. If after a minute or two it's actually just getting worse and worse and worse, it's too tender for this, and what you should do is back off, probably do some ice on it for a while, and then try it again and see if you can do this. So again, a couple fingers over the tendon, which is in the groove, and I'd like to see you do this for 3 to 5 minutes. You can do it every other day, and see if you can get some relief from this. Quite often what this does is it breaks up the scar tissue that was in there, and that scar tissue can keep breaking open when you're doing lifting, and that's why that pain can just keep going on and on and on. You may also want to watch my impingement video, because that can show why sometimes these develop in the first place. Sometimes they develop from the muscle getting pinched under the acromion, so you may want to take a look at that too. Good luck to you. I'm also going to be doing a video, I also did a video on the bicep pain itself, and I'm going to be doing one on tricep. So please subscribe to me if you haven't already. Thanks for watching.